Hi and welcome to Unlock the Body. This is an Activator Chiropractor's view of how we can adjust individual parts of the body. So I've got Carol on the couch and we are going to look at unlocking the ankle. I'll get Carol to tell the story. It was about 4.5 years ago, what happened.
So I was holding my granddaughter who was a baby at the time, going down some steps, and I misfooted and came off the steps and I heard my right ankle snap. And obviously I was more bothered about making sure my granddaughter was safe, but once she was in the arms of her mother, then yeah, it really hurt and I think I passed out.
So yeah, classic story for most therapists, or a variation on it. Definitely some lateral ankle, lateral ligament trauma, lesion, tear, snap. I was saying to Carol, do you have very specific, clear memories of that incident?
Yes, I do.
Yeah, and it's interesting. Sometimes actually smells, tastes, the colours of things. You can picture it. The phrase that people say is it almost like I was there. Like it was yesterday.
Yeah, definitely.
Is that accurate?
Definitely.
So the significance of that is where the memories of that and any emotional trauma, and it involved a grandchild, and so and the stepping in to protect, which is just a natural human instinct, but it's emotionally traumatic because the what ifs can do your head in, can't they?
Yeah.
Absolutely.
Yeah.
So any time there is any slight niggle on this sensation, Carol's brain's going back to those memories and actually hyping it up, because as I said to Carol earlier on, although she was good on her answer, if I said, what did you have for lunch 3 weeks ago? You can't basically remember. She reckoned it was fish because it's usually fish. But whereas actually that incident 4.5 years ago, crystal clear memories about details of it. So that is one of the things we're trying to deal, and it's actually the job of a chiropractor when you're adjusting people is to reinforce those memories of it being okay. So actually your brain starts to learn the library of memory is now that there actually isn't that much of a problem. You've got a memory of an incident that's not going to go away, but it starts to down-regulate it because that changes how we interpret pain signals. Right, anyway, so back to it. So actually, Carol, nice and level in position 1. Do you know what your PD is? Is it?
No.
Yeah, I think it was right from memory, and if it's anything, it's slightly right. So yeah. So Carol also had some sore ribs as well, which I adjusted a couple of weeks ago and is improving. So we'll check that again. I'm going to start right medial tibia. So first adjustment, talus. Setting 2 if we're going textbook, setting 2 on the ankle, setting 4 on the knee. Okay. So she's level, so we're a possibility 3 here. So squeeze your knees together and let go. Just go again, squeeze and let go. And I'm definitely getting a lengthening in on the right leg there, going into position 2. So that is a right superior pubic symphysis. You've got a couple of options. You can go onto the front of the pubic symphysis, or again, this is in the Activator textbook, on the OPD on the opposite side, just north superior to the ischial tuberosity. So basically your sit bone. So right about there, setting 4, and just straight posterior to anterior. Like so. Squeeze your knees together, let go. Clears it nicely. Good. Always nice to do it the easy, painless way as opposed to the other way, which is a possibility. Right, so right hand up behind your back. That one. Swap your hands. Both hands up behind your back together. Both back down by sides. Anyone's possibility 3, I'm kind of automatically doing position 1, position 2, going past the 90 into position 3, looking for superior, inferior, just as a check. I'm not finding it yet. Right hand up by your face. Big breath in and out. So basic scan that we all know and love. Left hand up as well. Both back down by sides. Turn your head to the right. Lift the right shoulder off the couch, back down. Shrug both shoulders up to your ears, down. Squeeze right elbow flat against your side and let go. Squeeze left and let go. So I got a little bit of a change there on the right, looks like a right lateral scapula. If you're not sure, here's a nice little tip for making sure. So squeeze your right elbow into your side and hold it there, and then be really fussy about it, and if it's there, it will be very obvious that you get that change, so which did. Right, head back into the center. There we go. And seeing as Carol has been spending a lot of time using the computer keyboard and the mouse, right arm tends to take a bit of a hit. Okay. Arm off the side. There we go. Okay, so turn head to the right again. Shrug your shoulders up and roll them back. Head back into the center. Lift up your head, back down. Tuck your chin down to your chest, back to center. Push face into the couch and let go. You know, one thing, best part of 20 years I've been doing this now, and one thing's interesting about the basic scan, you talk to people who've been doing this 20, 30, 40, 50 years, and they will all be meticulous about doing basic scan. They would always do it every time, which I've always thought is interesting, and I've always been taught to just listen to my elders and wisers because they're probably right. And if somebody's been doing this 50 years, says check basic scan every time, you should check basic scan every time. So, okay, just turn your head to the left. I'm just going to be fussy with upper neck here. Head back into the center. Turn your head to the right, look up top right corner. Look down at your right shoulder. Head back into the center. Turn your head to the left, look up top left. That's the one, there we go. Head back into the center. So, slight tuck of chin down to your chest. And this is a C4 on the left. 2, 3, 4. And head into neutral. Okay, so thinking ankles. Starting with calcaneus, superior calcaneus. We've got just a straight tissue pull for inferior calcaneus. Medial and lateral is just a thump. And yeah, there's a very clear medial calcaneus. So when I give it a thump on the outside, I see a shift in leg length. So I tend to go setting forward with these. I think heel bone is big and strong, takes a lot of, it's used to being loaded. So let's go in there. Moving on to the distal fibular head, thinking of those ligaments, you've got the 3 ligaments there. So we've got posterior, nothing. Anterior, I'm pushing forwards. I'll show you on this side. So I'm just pushing and pulling. So that last one was pushing forwards. Huge change. Huge change. So it's a good guess that the ligament that Carol ruptured, heard go snap, was the anterior of the 3 there. I'm on setting 2, Carol, but this can be a little bit lively. How was that?
Yeah, good.
Yeah, not too bad, yeah. Yeah, there we go. Talus, worth checking. That is the test actually for the anterior distal tibia. Ooh, big change there as well. We'll get to talus in a minute. Anterior distal tibia. obviously you've got that ligament, the flexor retinaculum goes around in there, and the kind of injury that Carol's describing, you know, it wouldn't be surprising if it took a bit of a hit. Push against me, and let go, which is a gastrocnemius test. Push your toes up towards your head. So go the other way. That's the one. That's it. And again, and let go. And that's the test for a anterior talus. Seems to be okay. What I call the arch one, that is a anterior lateral talus. All seems to be okay. Metatarsals seems to be okay. I'd probably be happy with that. Let's just check the other end of the fibula. Yeah, and as I push anterior inferior, I'm definitely getting a change there. So there's a posterior standard activator, posterior superior, proximal fibular head. Actually, in this case, an anterior inferior, which with me coming from McTimoney, that was the subluxation of the fibular head I was taught. There's a lot of crossover. Okay. Push both knees down into the couch, and there you go. Checking psoas, but largely speaking, I reckon we are there. I check a lot of superior inferior sacrums as they tend to come up, and I'll just chuck in the internal external ilium as well, because if you're talking about whole leg structures, they're worth checking. So lift both hips up off the couch together and back down. We're good there, and then looking for that internal external ilium. Now, we are good. So the kind of things you can look through, certainly with lateral ligament traumas, the fibular head, the anterior, posterior and inferior, well worth checking. There is a lateral for the proximal that can come up as well, especially with your football players and horse riders around these parts. I hope that was helpful. I'll see you next time.